Welcome. I'm Lisa Berkman. I'm the Thomas D. Cabot Professor of Public Policy and Epidemiology here at Harvard T.H. Chan School of Public Health, and I'm delighted to be joined today by Senator Chris Murphy, a Democrat representing Connecticut. A quick note for our audience that Senator Murphy and I are here to share our views, and we do not speak for the school. So Senator Murphy, I've read your National Strategy for Social Connection Act, and I've also been reading some of your opinion pieces, and I'm really interested in your frame about social connection and social isolation. I find it much broader than the loneliness kind of frame that's often invoked, and some parts of the Surgeon General's report, and your emphasis really on the broad need for social connectedness. So it's a perspective that personally I think I resonate with, and it really is supported by a lot of the evidence. So I hope that today we'll have a chance to share a lot of your views on this. But I'm really curious about how you came about to be interested in this issue, and why is it important to you?
Well, first of all, thank you for having me here today. Really looking forward to the discussion. Listen, I don't think there's a real easy, simple answer to the question of how I have decided to spend a portion of my time in public life talking about social connection, and more broadly talking about what I would diagnose as a real spiritual crisis in this country. Mm-hmm. But I don't think any of us can mistake that something is happening in America today. You see all of these signs that people are at their wits' end, that they are exhausted, that they are angry and anxious. That comes out in the rates of self-harm, the rates of addiction, the rates of violence against others, the polarization of our politics. It feels sometimes as if this country is coming apart at the seams. And I think it's incumbent upon policymakers to do some real broad question asking about why people are feeling this way. I think at the heart of public service, right, at the heart of my obligation as a public servant is trying to set rules for society in which people have the best shot at happiness that is possible. I should care about what makes people happy, because what business am I in if not the happiness business? I can't deliver happiness, but I can set the laws and the rules of society in which people have a shot at happiness. And what I know about happiness is that it's really deeply connected to social connection, more so than it is probably connected to economic success, that happy people tend to be people who have good, positive relationships, who feel positively connected to the community in which they live. And so to me, I've just decided that I'm going to spend more of my time trying to help people find that social connection, compared to maybe the amount of my time that I'm going to spend on purely economic questions. And so I know we'll talk today about the extent to which we have a social connection crisis, to the extent to which we have a loneliness crisis. But I've just come to the conclusion that my job is directly connected to this question of how people are feeling about their relationships and how people feel connected to their community. I'll say one other thing about this. I definitely have personal intersections with this epidemic of loneliness. I have spent a lot of my time in public life working on the issue of gun violence. And there's just no question that people who either take their own life or people who turn a gun on others tend to be people who are very disconnected from their community, often are very lonely people. I am the parent of two children. One is a teenager, one is a preteen, and I am seeing firsthand the way in which our young people are increasingly withdrawing into themselves, are many times very dangerously lonely. So I experience this firsthand. And then I'm in a profession, it's a weird one, right? Where you spend all of your time with people, but can often be very isolating, right? The burdens you have, right? The responsibilities that you have as an elected official can often make you feel lonely, even though you exist in a world in which you never ever are missing connection with human beings. So I think I come to this issue from a bunch of different perspectives.
That's really enlightening. So maybe the $1 million question is, can you talk about why you see it as a government role to address social isolation or loneliness, and is there a government response like in other countries? Are there other places that you hold out as a model here?
After I'd been at this for maybe a year, writing, introducing legislation, convening conversations about it, sort of one of the mainstream political publications in Washington, D.C. wrote an article that was entitled "Chris Murphy Wants to Help You Find Friends." And that is not necessarily the proper role for government to help individuals find friends and companions and boyfriends and girlfriends. But I don't think there's any way to deny that there's a real public health and public policy intersection. The Surgeon General's report, makes it very clear that people who are lonely, people who are feeling alone, there are immediate public health and health care consequences. They are more likely to have heart disease. They are more likely to, if you're older, to suffer from dementia. And so, we spend a lot of public dollars on healthcare, and we would spend less dollars on healthcare if people felt more connected. But I also think the state of our politics is a very dangerous one. And if I had to guess, many of the people who stormed the Capitol on January 6th, many of the key people who were part of that right-wing rally in Charlottesville were pretty lonely, disconnected people who were searching for meaning and identity because they couldn't find it through normal pathways, and they found it through extreme politics and extreme political identities. So there is just no doubt that there's an impact on our political life and on public policy when people are feeling very disconnected, and hopefully we'll get into this conversation, but there's also no doubt in my mind that there are public policy solutions to help people feel more connected. It is not just a private sector concern. There are public policy choices we have made about what we've done and about what we've deliberately chosen not to do over the last 10 to 20 years that have made it harder for people to find connection.
So can we keep going down that path?
Yeah.
Because that is the most important path, and I think would resonate to many people in the room that we see population health and public health as needing structural and institutional sort of solutions. And certainly when you think about prevention is really important and sort of calls upon those structural things. So when you think about the kinds of policies that our government might do, can you be more specific?
Sure. I mean, I'll take two really concrete, easy to understand examples, and then maybe one that's a little bit harder and bigger. So listen, there's just no denying that we've got these devices in our pockets that are tearing us away from each other. And I try not to be too hyperbolic about anything I engage in, and I think there's a risk of blaming everything on smartphones. But there's just no doubt that our addiction to these phones and to screens and kids' addiction to social media is a big part of the reason why folks are withdrawing from social contact. And so I do believe that the smartest and most impactful thing we could do for connection is to much more rigorously regulate the way that young people have access to social media, because I think we'd have a shot at making kids' lives healthier if those algorithms were less tempting, and I think we'd give adults a shot by forcing that addiction to happen later. I think leisure time is a really big, important part of this conversation. You have to work 70 hours today to earn the same quality of life for your family that 40 hours delivered for you a few decades ago. So when you don't have leisure time, you don't have the ability to join a church or a social hall. You don't have the ability to be active in a neighborhood group, the places where you find connections. So I think we've got to have a real concentrated strategy of delivering Americans more free time. And that can't happen unless the minimum wage goes up and unless we deconstruct the economic concentration of power in this country. The third thing that I think I have a less good handle on is something that I'll be talking about at the Institute of Politics tonight. We've also had this transition in this country, dictated in part by public policy choices, away from a more general concern with the common good towards a much more individualistic, atomized society in which you just are left out on your own. to succeed based on your own merits, right? The tyranny of meritocracy. That leaves a lot of people feeling pretty lonely. Separate and aside from whether they have friends or family that they can connect with, if your society is telling you that we really aren't stitched together and that it's weakness to rely on somebody else and that you should just figure it out on your own, that in and of itself leaves you feeling kind of isolated and lonely. And so public policy has something to do with that, right? We can make the choice to see sectors of our society not as a fountain of profit, but instead a mutual concern. And that's, I think, a really important part of the conversation as well.
So those three things, I think, are essential. So can we come back and talk about each of them a little bit more? I think especially with regard to younger people, the data are pretty clear that social media is making people more isolated. Sometimes it makes other people more connected, but in general, I think the issues that you've raised about social media are compelling, especially for young people. I'd like to turn a little bit to workplace policies, and especially if you think wage is part of the story in terms of working so many hours, but also how work is organized, I think can be potentially quite detrimental to low and middle income workers, maybe everybody, but certainly for more people in more precarious positions. And the last one is the culture question, which I always think is true, yet I also am at a loss, like, okay, so how do we change the culture? Like, what are their ways that we could do culture change? But if we go back for a second and focus on the workplace one, because in part I think of work and labor policy and wages, and the inequality that we're experiencing in the United States is so intertwined that how work is organized brings both public policy options to the table, but also private sector policy options. Can you talk a little bit more about what you think some of the work policies are that might really improve the social connectedness that we have?
Well, this is a super unfair question because you've given way more thought to this than I have. I'm sitting here with an expert on this question. Obviously I start with this question of structural wage policy, that you ultimately have to have a society in which people can stop working after 40 hours and that they can engage in other pursuits that we know are incredibly important for emotional health. And so I think that that's kind of a period stop conversation. If everybody has to work 80 hours a week, then it's really hard to have a real shot at emotional health. I think scheduling policy has a lot to do with what drives people crazy today. Many people that are working in lower income jobs have no reliable schedule. They don't know their schedule until a day ahead of time. How can you plan for any extracurricular life? How can you plan meaningful time with your family and friends if you don't know your schedule more than 24 to 48 hours ahead of time? And that's something that public policy can say a lot about. I gave a speech 2 months ago comparing the benefits of churches and unions, and I was kind of making the case that the institutional atrophy we've seen in our society has a lot to do with why people are feeling unconnected, and so there's a different set of things that make churches more healthy than unions, but there's a lot of public policy that makes unions more healthy, and if unions are more healthy, then you have a better shot at a decent schedule and higher wages. But you also have a union in which you are bound together with
community.
You have a community, right? You have a community, a place where you're sort of learning the value of selflessness and about community care. And so I just think stronger unions, stronger organized labor is a big part of making people feel connections. So I don't know. Those are some of the places that, and then I think we probably have to have this conversation about remote work. And I don't think that that's an easy one for government to play a big role in, but I certainly do worry, especially for younger workers, what it means when your first job or your second job is one in which you never see your other employees, your other coworkers. I don't think that that's a way to build healthy, connected work life.
Yeah. Well, no hints needed. You nailed it. Like that, I think those are really, really important policies, all of them. One of the things that I would only add is that as there are so many people and dual wage earners in a family that this becomes essential to be able to have this. And the one other role of government might be parental leave or family leave policies, really family leave or just sickness absence policies that are both public and private sector sorts of things. But I think the wage issues, the flexibility about scheduling, the precarity of work are completely central. That's
No, and I think that's
truly important.
Yeah, and I think I think the parental leave piece of this and the family leave piece is so important, because as you're thinking about, again, if we do believe that it's those really positive relationships, often with a family, that define you, that is the moment of greatest vulnerability. That is the greatest that is the moment of greatest potential connection, is when somebody in your family needs you, requires you, and your inability to be there for that person when they need you. It has an impact on the relationship. It does. It has an impact on the whole social structure of the family when that individual who needs help, who needs constant care, doesn't have somebody. And so parental leave, family leave, it's kind of essential to building that connected, healthy family.
Yeah, no, really important. So maybe we can turn a little bit to, you've got the commitment and the perspective that I think is really essential. But what's the response you've gotten from other members of Congress here? And where do you see allies or, potential to build kind of a commitment to the cause?
Well, I mean, let me start in a slightly different place, which is this. So I'm about a year and a half ago, I started doing this work. The first thing I did was publish a piece called "The Politics of Loneliness." And I published it in kind of a center-right journal that nobody in my state reads. I love the Bulwark, but not a lot of people in Connecticut are picking it up. And about a week after I wrote this, I went home to Connecticut, and everywhere I turned, people were like, "Oh my God, thank you for saying something about loneliness." And I was like, "How did you read my piece in the Bulwark?" And it had just gotten around via the old-fashioned channels. Somebody had seen it, posted it on their Facebook page, emailed it to a friend. They had never seen in Connecticut a politician talking about loneliness, and yet they were intersecting with this feeling, this emotion every single day. Their child was feeling lonely. Their mother was isolated in her home across the country, and they were like, "Yes, please talk about this." They didn't exactly know what the next step was, but they were thrilled that somebody was talking about it. And so one of the things I try to tell my colleagues is that, yes, this feels a little squishy. This feels not like the normal thing that politicians talk about, but I swear, if you talk about this, people are going to love it because people are experiencing this, and they know that they don't have all the solutions. They know that there's something societal, structural, connected to public policy when it comes to their intersection with aloneness and loneliness. But the good news is that it doesn't feel right now like it's a particularly political or partisan issue. I just met last week with Senator Pete Ricketts, who's a new Republican senator from Nebraska. He has his own bill, sort of dipping government's toe into the question of loneliness. I've had a bunch of other conversations with pretty conservative Republicans who are not sure yet what to do, but know that this is important and want to be a part of it. And so I think that this is a conversation that is maturing in real time, but I have hope that it is one that can kind of break through the partisan sort of frame that sort of layers on everything in Washington these days.
It seems like it has that potential.
I hope.
If anything has some potential to be bipartisan, like this could have legs in that way.
And the Surgeon General's work here has also really, has also really turned up the heat on and the pressure on public policy makers. So I think his work has been essential.
Yeah. No, that seems really good. So is there is there a particular pitch that gets you in the door for among your colleagues, not among, I think among voters, I can totally understand how this resonates, but is there an angle that you feel like is particularly appealing to other senators and Congress people?
Well, that conversation around social media, right,
Yeah.
is a very real one, and it is again a conversation that doesn't seem to be hyper partisan right now. I do think that we are going to take some steps pretty soon to regulate social media for children, and so talking about this epidemic of loneliness through the prism of the conversations happening on social media is important. I think it's also important to recognize what government can do and what we can't do. And so part of the way that you build Republican support is to say, listen, we are not really talking about standing up new massive government infrastructures to build social connection. We're talking about empowering private life, empowering civil society. I gave that speech on the similarities between churches and unions because I wanted to show that there's something for everybody here, right?
Yeah.
Progressives might be attracted to unions being healthier and more powerful. Conservatives might be attracted to government policies that could make churches healthier and more powerful places. But I think it's important to just show that this doesn't fit into any convenient ideological or political box. It kind of has something for everybody.
I think that's really compelling. It also resonates. It's kind of interesting. Like in our data, we would say that we've found an enormous amount of substitutability. Like it doesn't matter whether you belong to a union or a religious group. It matters that you don't belong to either.
Right.
It doesn't matter whether you have friends or relatives. It matters that you don't have any. Right. And so there are lots of choices as we think about how to build community. And it doesn't really matter. Like there are lots of choices. The point is, at the downside, when it becomes really unhealthy, is when you're so disconnected that there are no ways that you reach out. So this analogy of religion or union or work or family, like it doesn't have to be. It's not dichotomous thinking. It's sort of like people's preferences and choices.
No, 100%, and it just stands to reason, right, that we are happier when we feel part of a community, and everybody knows that those communities are harder to find today, right? That those institutions are weaker, that our local places that we used to find community are weaker. Our downtowns are gone, right? You can't find community at a Walmart, right? But I found it at my local grocery store when the guy who worked behind the deli would sort of stop every time I went in there with my grandfather and have a conversation with us and give me a free slice of cheese to prolong that conversation a little bit longer, right? Like that was community to me, was the relationship I had with my grandfather and that deli guy and the local grocery store. That is not available on Amazon, right? It is just not. And like that, and that's a weird thing for public policymakers to talk about, but the minute you start that conversation, everybody's like, oh, exactly, right? I want that back, right? Maybe not exactly how it existed, but I want that ease of connection to my neighbors and to my local economy in a way that I don't have today.
Yeah.
And I don't care whether it comes from right or left politics.
Yeah. It isn't right or left at that point. It's a beautiful story of a neighborhood grocery. And I think that corner store grocery is also very compelling, that people go. It means that there's trust, that they know you. Your kids can go there, and it just counts.
It counts. Yeah.
You leave there and you feel better.
You feel
right?
better, right? You leave that little
and
interaction that you had, right? With that deli guy who's not in any of your other social circles, right?
Yeah.
Who you're not going to encounter at the kids' school, right? But that's how you feel stitched together with everybody else, is that you have the ability to find people who is maybe not more naturally part of your your cultural association.
Yeah. Now, we would call those weak ties, the strength of weak ties.
Yeah.
They're not your closest friend, but they make you feel like you're part of something and you belong.
Yep.
And it feels good. So we've talked a little bit about young people. I know you also have co-sponsored a bill called the Silo Act, which looks specifically at issues of older people who also face, I think, some real conundrums today in terms of staying connected. Can you talk some more about that and what we need to prioritize for older adults?
Yeah. I mean, obviously, we're just living in a world where people are living longer, and so we've got to think more about their health. The Surgeon General's report is just so clear that without connection, there are real immediate physical health consequences, and a lot of those are most acute for older people. So if you want to keep, we have this overly medicalized model of health in this country in which, the way that we treat someone, and just true that older people have more things to treat, is a drug or a visit to the doctor. And what Murthy is saying is that no, actually, one of the things that matters most is connections. And so should we be really thinking about taking the billions of dollars that we are spending on the medical industrial complex and starting to spend a little bit of those dollars on senior centers, right? Or on outreach efforts to seniors who are living on their own? That just seems like really smart public policy to me. And so that, I think, is a conversation that has to happen. But I think a lot of this is back to the structure of the economy. So what has left a lot of older people alone? It's the fact that their kids can't afford to live in their community any longer. This happens in Connecticut all the time. Young people cannot afford to live in Connecticut, and so they leave. Maybe that wasn't the way they wanted it to play out, but they had no choice, leaving their parents behind. I saw this in rural North Carolina as well. I went down and did a roundtable on loneliness and social connection in Appalachia. And that was one of the great frustrations that they had, was that the jobs are gone. The furniture industry has disappeared. They thought they were going to be able to live in Boone, North Carolina the rest of their life, but they can't because the jobs have disappeared, so they're leaving, and they're leaving their family behind. So by creating a fairer economy in which everybody has the chance to stay home because all the jobs pay you enough to survive and buy a house and invest in your community, you also have a chance to keep intergenerational connections physically closer, which is a really important way to reduce the rates of isolation of seniors.
I think those are two really, really good examples, and they're both, the geographic isolation that comes from kind of these deserts where business has moved out has created one set of problems, and the housing market and the way housing works is another market where most people would like to age in place, not necessarily, as I understand it, in their same house or place, but in their same neighborhood.
Yeah.
And we make that really hard. Like
really
both
hard.
those. That's like one of the places where government, those policies around housing and business seem like two other areas that are sort of ripe.
No, agreed. I mean, I think so much of what ails this country today is the low housing stock, and so you solve a lot of problems by just increasing housing supply. But in many places like Connecticut, and I think probably Massachusetts, we make it virtually impossible for you to just have a multi-generational household. So the number of hoops you have to go through to create a dwelling unit on your property that your father or your grandfather can live in, it's impossible. It's enough to drive you mad. So there's even just land use and housing and zoning policy that would help reduce the loneliness of seniors and grandparents.
No, and those don't have to all be federal, right? They could be state, local, anything. So in our audience are mostly public health people. I think they're quite used to kind of intersectoral broad thinking, like along the lines that you've been doing, but can you talk some about recommendations for, folks listening today about where public health should be going in terms of this kind of issue?
Yeah, what I think a lot of us need help with when it comes to sort of public health policy is really understanding how to more functionally start that conversation that I referenced on the way in which we spend healthcare dollars, right? There's no doubt that we're spending healthcare dollars badly today. There's no doubt about it.
Yeah.
But it feels really scary to take the confines off of the very overly medicalized spending model we have, because where does it stop, right? So there's no doubt, for instance, that that food is health, right? But it also feels really scary to say, okay, you're now going to be able to use Medicaid and Medicare dollars for your entire food budget. There's no doubt that social connection has a huge role to play, but where do you begin and end that if you start to let Medicare dollars be used to get seniors out of the home and connected with friends? And so I think sort of starting to talk about pilot programs and limiting principles in terms of how public health, how reimbursed dollars, how Medicare and Medicaid dollars are being used would be really, really helpful. So that's one suggestion is sort of how do you not completely bleed together the work of reimbursable public health dollars versus public health dollars while arguing that the balance of spending is probably pretty indefensible.
Yeah, and I think in the UK, for instance, there's some fledgling policies about social prescribing or reaching out to blending social services with that. That isn't, I don't think, as far-reaching as what you're saying, which is truly this intersectoral approach, which is probably central.
Yeah, I mean, I have this like ongoing conversation with my healthcare team because I do care a lot about the social determinants of health, right? And I know you guys talk about that a lot, but like nobody knows what the hell that means, right? And that feels like the perfect way to begin and end a conversation with regular people is to say, I want to talk to you about the social determinants of health. And they're like, all right, that's like your language, not my language. And so I do think we have got to like figure out a way to talk about, but this is a topic that everybody knows, like everybody knows that if you don't have a house, you are likely to be less healthy, but they would like us to talk about it in ways that are relevant. And sometimes as public health and public policy professionals, we do not talk about this in a way that's relevant, which is why I talk about loneliness, right? I've started to use social connection a little bit more, but I probably shouldn't because social connection is like an us word. Loneliness is like an everybody word. And so we can also help each other by like talking about this in ways that, non-professionals and non-PhDs talk.
Well, that is a great closing part of this in terms of understanding social determinants of health and thinking of social connection or loneliness as like an important central part of that. So I want to thank you very much, Senator Murphy. I think we're all at time today. So if you've missed any part of the program, you can rewatch it on our YouTube page, and have a great afternoon. And thank you very much. It was a terrific discussion.
Appreciate it. Thank you.